Welcome back to Healthy Living. I'm here now with Emily Pupo. Emily is the supervisor of palliative care for our home health and palliative care and hospice team. And we're super happy to have you here.
Thank you. Thanks for having me.
Thank you. We're going to talk a little bit about advanced care planning because it's an intricate topic and it's extremely important. But before we do that, tell people about you. What do you do for St. Tammany Health System? I mean, we know you're a supervisor of palliative care. What does that mean?
So I oversee the nurse practitioners, physician, and nurses of palliative care. We have an inpatient consult service. So when our patients go into the hospital, we can see them, check on them, and establish new patients as well. We also have a home visit program. We're at the Cancer Center, and we have a clinic on Polk Street.
Okay. So what about you? What drew you to this facet of healthcare?
So palliative care is very specialized. It's very personal to, well, everyone in our department. Each of us have a personal reason for being here. My mom, for example, passed away a few years ago, and without the palliative care team speaking to me, I don't think I could have done it. It was very difficult being there. Anticipatory grief is a real thing. Watching your loved one suffer is hard. And so having that extra layer of support for not only my mom, but for myself was very important. And it kind of led me to where I am today.
Okay. And you and I talk a lot about what palliative care means, hospice care, home health. We talk about all those topics. Mm-hmm. And we talk about another topic that is a companion to those topics, which is advanced care planning.
Yes.
And you often describe advanced care planning as a gift that you can give your loved ones. So what is advanced care planning, and then how is it a gift? So let's start with what is it exactly?
What is it? Okay.
Yeah.
So there's multiple different types of advanced care planning. There's living wills. Mm-hmm. There is a healthcare power of attorney, and advanced directive, and there is also a LaPoste, a Louisiana physician's order for scope of treatment. Mm-hmm. Each one of those documents is a little bit different. The most important one, in my opinion, is the healthcare power of attorney. You want to make sure there's a person that knows what you want in the event that you can't speak for yourself, and then will be able to fulfill what you want. They'd make healthcare decisions in the event that you couldn't speak for yourself. Mm-hmm. And a living will is a little bit simpler. It just kind of is a yes or no question of, would you want to live on life support, or would you want to withdraw care if that was the only thing sustaining your life?
Right.
And then the LaPoste spells it out specifically. So you have, CPR versus no CPR, intubation versus no intubation, mm-hmm. feeding tube versus no feeding tube, etc. And so those forms are very important, but it's a gift because there's no guessing. Mm. So for example, with my mom, it's difficult when all these doctors are coming at you, what do you want to do? You want to do this? Do you want to do dialysis? Do you want to, do a feeding tube? And you're like, well, I don't know. Mom said she wanted to fight, but I don't know if she would want that. And dialysis is a lot.
Right.
There's a lot of guessing that goes into it. When you have these documents already in place, your loved one doesn't have to guess.
Right.
And so that's how it's a gift, is they don't have to live the rest of their life thinking, maybe a mom would have wanted that. Maybe dad would have wanted that. You already know what they want because they signed their name on the paper, and they said what they wanted.
Right. And, talking about end of life or a critical illness or a surprise illness that you end up in the hospital where you cannot speak for yourself, that's not a fun topic to talk about. And it's a stressful time anyway.
Right.
So during that stressful time, if you have one thing that can lift that stress, knowing, like you said, what your loved one wants, it can make all the difference.
Yeah, it's very emotional, and it's hard not to make decisions off of emotional feelings.
Right.
So of course, if something bad's happening, you want to save your loved one.
Right.
But already having that document in place and knowing, okay, mom did say if this happened, she would want this to happen.
Right.
You can, instead of making emotional decisions, you can be there for your loved one, holding their hand instead of guessing and trying to decide what they would want.
And we've talked a lot about this, about certain cases that you've had, and one of your colleagues and my colleagues talked about her own dad, and how his advanced care planning was so important because he wanted extra care, and she was thinking, well, he would never want that. Well, he did indeed want that, and he recovered. And so it was very important for that document to be there and them to have that conversation.
Yeah.
And I do want to touch on the power of attorney.
Yes.
Because oftentimes power of attorney means, you're giving someone control, but I want to make the clear distinction that a healthcare power of attorney is only if you're incapacitated.
Right.
It's not someone who's going to make a choice for someone who's speaking and coherent, correct?
Correct. So in the state of Louisiana, healthcare power of attorney does need to be notarized. So we do recommend that done through a lawyer. Southeast Louisiana Law is, they do a lot of pro bono work as well. So they're partnered with us on a lot of patients that need assistance. But I will say for a healthcare power of attorney, it's not the same as your financial power of attorney. They are separate.
Right.
And the healthcare power of attorney only goes into effect if, for example, my husband would take over if I wasn't able to speak for myself. And there is a hierarchy that I like patients and families to know about. If you don't have a specific person laid out, there's a hierarchy in the state of Louisiana. So it's your spouse. You have to be divorced. So for example, if you've been separated for a while and you might have, a new loved one that you would want to make those decisions, in the event that you're incapacitated, if you're not legally divorced, for example,
Your spouse is the one.
your spouse is the one.
So there's little details.
There's little details that you don't think about, and it's if you have multiple children, it's a majority rule. So you can imagine it can cause a lot of tension sometimes in families. So I really recommend everyone has these documents in place. They're very simple. Most are free to complete at our palliative care clinic, and it just makes things a lot easier so your loved ones can actually be with you in that moment.
Right. So you mentioned the clinic, excuse me, but there's ways that you can come to you in the community, because you have several events throughout the year that are specifically honed in on advanced care planning. It's advanced care planning workshops, and they're free and open to the public, and your team is there. So you can help with various different things regarding this. So what do you want to say about the clinics? I know we're going to have a whole litany of them in 2024.
One every month.
Yes. So there's a great opportunity for everyone. What would happen when I come to the clinic?
So our palliative care clinic, it just depends on what the referral from your doctor is for. Like Kathy Ann mentioned previously, symptom management is one of the big things we do. But we can also see patients just to complete the advanced care planning documents, have those tough conversations, explore their goals and what's important to them. And at our events monthly, which we'll be announcing soon, events for 2024, they're just out in the community, free events that we can complete the documents on site for you, or you can always call our clinic and you can come in and we can come to your home or the clinic to complete the documents for you.
Okay. Well, is there anything else you want to add about anything we talked about today?
I just want to thank you for having us, and we're very excited for the next chapter for palliative care. We're growing quickly, and we look forward to caring for more patients.
All right. Well, thank you so much, Emily.
Thank you.
And thank you all for joining us. That is going to do it for this episode of Healthy Living. We'll see you next time.